It's so tricky, y'all. Like, nursing school are trick questions. So, I just got done taking my second exam, and the exam was on nutrition, spiritual and cultural competence, and it was also on more nutrition. So I got an overall grade of 88%. It was out of 60 questions. 5 of the questions were written questions. Some questions had reconstitution problems on it. And yeah, so basically the exam was not what I was expecting. I studied my butt off, which, you know, you kind of get used to in nursing. You study your butt off, and the exam is kind of random. Kind of apply the information you've studied so hard on. A few razzle-dazzle questions in there. So I'm overall happy with my grade. And as I've mentioned in past videos, at my school, at my institution, a 92 and above is an A. So I got a B. And I'm very happy about it. But I want to talk about, can we normalize not comparing grades? Like, I don't know what it is with some people's obsession about it is with comparing grades, but what I kind of gather from it is if you get a high grade and you're obsessed with comparing your grade to everyone else, I feel like it's just to like boost yourself, I guess, in a way, boost your confidence that you got a good grade over everybody else. And really what it's doing is, for the people who got a lower grade than you, or just barely passed with a 76 or above, or didn't pass, you're just making that situation and the way that they feel even worse, because it really is a lot of stress, and it really does take a lot out of you to take an exam, like the anxiety that goes with it, the studying that you do, you know. And then if you're a person that's working like I am, and you know, you're comparing your grades to somebody else that may not be working, or whatever the case may be, you know, just stop comparing. Like, comparison really is the thief of joy, and it really is not healthy confirmation for a person that did get better than the next person. It's not healthy for you to feel good that you did better than somebody else. So let's just stop comparing, guys. Like, and I'm not saying that out of a place of getting bad grades, because I've been getting good grades, but it just, you know, when you're friends with other people who may not have done well, you know, you tend to have a different perspective on, like, maybe we shouldn't share grades, because it does become a personal thing if you're going through your own personal battle, your own personal self-esteem issues with nursing, because it is very challenging. And just because the exam is challenging for you does not mean that you should not be doing nursing. So right now, little rant is over. This week I have oral medication check off using the MAR. So I have a scanner at home, and I have some pills that I can scan to practice that. And then I also have an interactive case study, which is basically kind of like a part of clinicals, where I get this patient, I review their medical records and such, and then I make nursing actions or interventions for them. And then I also have, next week, I don't know if I have a virtual simulation. We're about to start doing these virtual simulations because of COVID. Usually around this time we'd be going to clinical after spring break, but I have to do the injectable medications next Thursday. So I have a few things coming up. I'm super duper happy that the exam is over. I did well. It's over. I did well. We're moving on. A part of the reason why I care so much about my grades is because of my own personal standards, and also because I want to be set up well for when it comes to continuing my education. You know, wanting to continue to my master's, or, you know, just deciding on what I want to do next with my nursing degree. I want to make sure that my GPA is, you know, up to par. So, which I am doing. I'm going to continue to do what I'm doing. But the one thing, guys, the one thing, or why do I keep saying the one thing plus the one thing and the other one thing that I could tell you guys is to do NCLEX style questions. Practice with the NCLEX style questions, because the exams that you do in school are going to be NCLEX style, even though you're not testing for the NCLEX. So it's going to be all application of the information that you're doing. So not only do you need to be studying the information down to a T, damn near, but you also need to be studying on how to answer the questions. That is the most important, not the most important thing, but it's 50% of how well you'll do for that exam. So, do you know how to answer these questions? Understand what the question is asking you. Understand what the patient's needs are, and understand prioritization with these questions. So, I do need to study more. I think that's what's kicking my butt for real, is questions that I eliminate. Because you get 4 choices. I eliminate what what doesn't make sense, and then I'm left with 2 answers. Those 2 answers are right, y'all. Both of them are right. But what's kicking my butt is differentiating the difference between a correct answer and the most correct answer. So I need to study that, and I'm also going to put some of the rationales in my Quizlet so I can start getting in my mind and start memorizing how some of these rationales work and why they picked that answer for that question. It's so tricky, y'all. Like, nursing school are trick questions. It's tricky. Like, and I'm every exam and every test that I take, I'm getting better, but I still want to get to that above average level, if that makes sense. So I'm super proud of myself. I was so, like, I got a B on my first exam, and I was so disappointed because I have never studied this hard in my life for anything. I could just study a little bit for, like, you know, back when you take your regular prereqs or whatever, and I would get an A. That's with me applying myself a little bit. I'm applying everything, every being of myself into this program. And so when you don't get a certain desired whatever that you're looking for, it can be discouraging. I'm telling you guys, do not let it discourage you. Keep going, get through the program, make adjustments where you can. If you absolutely cannot make adjustments because of work, because you're a single parent, because of whatever the case may be, then just figure out a different technique. You know what I'm saying? Like, sometimes you just can't add additional work for you to do to study because you just don't have the time. Just use a different technique and figure out what works, you know? So this next week, we're going to start with the cardiac and cardiac disease, cardiac events that may happen, what we need to view for the what we need to view as far as electrolytes when you have an at-risk cardiac patient, diagnosis of that. What else? Oh, also medications. So that preload, afterload thing with the heart. You know, we're getting back into kind of the anatomy and the physiology of things. So, you know, we need to know what that right side of that heart does, what that left side of that heart does, and which medications affect which side of the heart, and what symptoms will arise from which side of the heart. So it's going to be a very busy week for me. I'm going to film as much of it as I can for you guys. My time management is getting better, but there's always room for improvement. And as crazy as it sounds, as crazy as the information that we're getting, as crazy as it all is, that after an exam, things kind of relax a little bit, and then it'll get crazy again exam week for the next exam. So yeah, guys, I have spring break in like a week and a half, 2 weeks. Like, we're halfway through. We're just chugging along here. And yeah, I'm on my way home, about to go eat a salad, and about to, you know, do the other things that I need to do to be a well-rounded individual during nursing school, like working out, eating healthy, my affirmations. I'm trying to get back into reading the Word of God. And they just stopped abruptly. And so yeah, I have to add those other things in. So when I look at the grand scheme of things, as I reflect on my grade and if I'm happy about it, I am happy because I have been able to maintain going to work, working out, eating balanced meals, drinking water, keeping on track with my mental health, spending time with my boyfriend, making sure my patients are okay, and I'm getting good grades in nursing school. So if you ask me, I'm killing it.